my name's Pamuk, and today I'm going to talk to you about innovations in at-home healthcare. Just a quick introduction. My name's Pamuk, and I'm a rising senior in Bethesda, Maryland. My name means cotton in Turkish. My family's from there. I'm currently working in an NIH lab, National Institutes of Health, and I'm a research intern at a pediatric oncology lab. It's really fun. I do theater and piano. I box a little bit. I also work in a few student advocacy organizations. I'm super interested in global health and medicine. And actually, this is my third time going to the GHLC, but it's my first time presenting, so I'm a bit of a noob at this. So I don't know if I can see the chat right now, but if you can you, just a question for the group, do you know what at-home health is? Like, what are some home use medical devices that you might use on a daily basis or when you're feeling sick? I don't know if I can see the chat, but I guess I'll just move on. Sorry about that. So my definition of at-home health is that it's just it covers a wide range of healthcare services that can be given at your home if you have an illness or injury. It's usually very non-expensive, very convenient, and it has to be easily carried out by non-experts, average citizens, people who aren't healthcare professionals. And a lot of them are just everyday household items that we don't, we kind of look over, I guess, like thermometers, things in the first aid kit, splints, bandages, that kind of thing. But they're super accessible and very important to the healthcare system. And the connection to global health, I actually thought about it during Dr. Quinn's presentation earlier in the summer. He mentioned how global health needs to be more focused on both an international and a local scale. And I feel like the most local and direct connection to healthcare that we have is through at-home health. What we buy from the pharmacy, what we need when we don't want to go to the hospital to get fixed for an illness or injury. And it's important because, unfortunately, a lot of people don't have access to the healthcare they need to go to the hospital every time they're feeling sick. They don't have private physicians or that kind of thing. And also sometimes in situations of crisis, at-home health products are the only thing that could save a life. So they're very important for a lot of people, and I think everyone should have them in their home. So this is a very simplified history of home health, like very simplified. So we start over in 3000 BC in ancient Egypt, where everything was at-home health. Basically, there were only handmade products, and people would heal themselves at home. That was basically how it works. And there's a holistic medicine that still works that comes out of this area. I know personally that whenever I have a toothache, my dad will crush up a clove or something in oil and rub it on the tooth because clove is like a natural antiseptic. So that's a little tip, I guess. Moving forward a bunch of years to 400 BC, we get to the ancient Greeks, like Hippocrates of Kos, and they began to expand on medicine and it really explored the human body, start doing a few dissections, and home health became a little bit more advanced. But then jumping way forward, you get to something for the first beginnings of organized home healthcare. There was a program in the 1880s where nurses would go to rural areas of the US and the UK, and they would heal people who didn't have the time or transportation or money to go to the city to see a doctor. So this was the only chance they had at home health, was this nurse coming to provide them with the tools they needed to care for themselves during the year. And now in present day, global healthcare is like a $10 trillion industry, and access is really spreading, but there's definitely a lot more that we could do. So now I'm going to go through a few products that you probably have in your home and that seem very simple, but they're actually very important. So the thermometer was invented in the 1700s by Daniel Fahrenheit, and it actually wasn't improved upon for a pretty long time. It took about 20 minutes to like an hour to actually get like an accurate read on someone's temperature, but it became faster and more accurate in the 1860s. And then again, it was improved another 100 years later. So in 1999 to be this sort of non-invasive one that we see a lot during the pandemic, actually, the one where they just hold it up to your forehead and they can read your temperature. And temperature readings are very important, you probably know, because they are a good indication of how your immune system's doing. So an increased white blood cell count, which usually happens when you have an infection, impacts your hypothalamus, and that makes your body heat up. So one of the first things you should do if you feel like you might be getting sick is take your temperature, because your body is trying to tell you okay, something might be wrong, and you can go from there whether or not you need to see a doctor. But taking your temperature at home is actually a really great thing to do if you're feeling sick. The next one is BandAids. Yeah, BandAids were pretty interesting. I'm one of my favorite ones to read up on. So they were invented by a Johnson & Johnson employee named Earl Dixon in 1920. And actually, fun fact, he invented them for his wife because she wasn't a very good cook. And she would constantly cut herself or burn herself on her hands when she was cooking for him. And so he started making these adhesive bandages for her to put on her fingers so that she would heal quicker. But then he gave the design to Johnson & Johnson, and they fixed it up a little bit and they put it on the market. And then they were used a lot in World War II, and they became super popular after that. And there were over 100 billion Band-Aids sold since World War II. So yeah, America and the whole world really finds Band-Aids super useful. And you need a proper bandage like this, even on small cuts, because obviously if you leave the cut open, then it's open to the world. And there's so many germs and pathogens in the world that could get into that open cut and end up infecting the skin, and it could be a real issue. So it's important to have a clean bandage on to keep the skin cells alive and to make sure that they heal properly. A quick note on the color of the Band-Aids. They used to be a very pale white color because that's what Johnson & Johnson catered to in the 1950s and 40s. But since then, they've changed them to this sort of beige tan color, which they say is sort of like the median skin tone of the whole world. It's kind of interesting to think about that, but they're meant to blend into your skin type. But other than that, it's just sort of something they throw off, I guess. Okay, face masks, something we're definitely all familiar with. So the first medical face masks were used during the Black Plague. You might have seen them in history books, the doctors with the long masks that had a nose in them. And actually, they were used to avoid infection because these doctors would constantly be seeing infected patients. And the long nose was actually filled with like noxious herbs and like poisonous herbs because they thought that that would filter the air coming from the patients so that the doctors wouldn't get sick. But modern face masks obviously are a lot different. They were used a lot during the pandemic, reducing the risk of infection by 85%. But before that, a lot of people use them would wear surgical masks on a regular basis to avoid infection or inhaling polluted air in very dense urban areas. So if you are exposed to COVID or if you're sick with something else, it's always a good idea to wear one, but they are only really effective if worn properly. Like, I guess the way this lady's wearing it is not great, but as long as they cover your nose and mouth, it's pretty good. And they also need to be used in combination with diligent hand washing to make sure that you're not carrying any pathogens on your hands. Okay, the last one I have is colon cancer screenings. It's actually one of my favorites. So colorectal cancer is one of the most preventable, but also one of the most prevalent cancers in adults. And the idea of an at-home colon cancer screening came about in a hospital in London, and then they collaborated with some scientists in Ohio to make it, because colonoscopies are kind of an invasive surgery, and not many people like to do them because they can result in some tearing, and they also need to get anesthesia to get them. So people would get colon cancer and they would never have gotten it checked because it's just kind of a hassle to go through colon cancer, the colonoscopy. So they decided to come up with this kit. And after many, many trials and lots of guidelines they had to stick to and changes to the design, they eventually got it approved. And now it's catching cancer in very early stages. So if you're 45 and up, I guess you should be doing this often to check if you have cancer. I know that colon cancer, if it's caught in early stages, is very curable. And this one that's pictured here, Cologuard, was invented in 2014 and uses a stool DNA. So super simple to use and it's life-saving. And I guess this is where I come in a little bit. So I last summer worked with Professor Deborah Feigenson at the University of California, Santa Barbara, with her startup company, which is called Fig Bioscience. And it was an idea that she had researched a lot before that she was thinking about turning into an at-home health product that could help people worldwide, especially during the pandemic. So she was very heavily researched in DNA nanotechnology. And her lab had been focused on the properties of DNA that could actually form a liquid. So my time in the lab was spent trying to see if this liquid that the DNA could form could actually envelop a virus, a COVID virus, and block it from entering a cell. And the idea with that is to hopefully eventually come up with some sort of nasal spray that has this liquid in it that basically stops any viruses from entering your system. That way you won't get infected. But it's still miles away from ever being even close to this product here. But it's definitely a unique idea. And that's the kind of things that we need in home health, I guess, is these unique ideas, because they could really save lives. So speaking of that, the approval for these kind of things is kind of a nightmare. It takes kind of like decades to get these things approved. So it starts out with discovery, and you have to come up with a unique idea and make sure that no one's ever had it before, get a patent and that kind of thing. And then you start inventing and prototyping, and then you go into preclinical tests once you have a solid idea, testing. But obviously you spend a lot of time in this area testing and retesting certain things. Like, it can take a long time. And then you go into clinical trials, testing it on humans and usually animals first. And then you go to the FDA for a regulatory decision. And sometimes you can be sent all the way back to the beginning and start inventing and prototyping again. But sometimes you get past and you can get a product launch. And then after that, a lot of times there's post-market monitoring, which is when, they start to test it on a wider population, the whole world, and you can buy these products. But if they start to see something wrong, then they can recall the products, and then people have to start over with the idea. It's happened a few times. And the reason it actually takes so long is because obviously we don't want to affect people's health in a negative way. There have been a lot of sort of scandals with scientists taking advantage of the sort of image that they have to create a product that they say will help people, and then it doesn't end up helping people. One specifically is the Theranos scandal that was pretty recent, where people lied and it affected people's lives. And you really have to go through this whole process and be very diligent, and you could end up helping a lot of people. But so it takes a lot of development for just a single idea to become a product, especially in the medical field. You need to go through years of research. You need to get corroboration from other people, and lots of trials. And it takes a long time for a reason. And we shouldn't be rushing the process, I guess. It's, people's health is very important and fragile. But that said, if we had more people working in the at-home health sphere, we could develop things a lot quicker and have more, variety of ideas, and it could be more accessible to people, and there could be new ideas on the market. And that way, people who don't have access to, expensive physicians or treatments or tests can actually do it at home and, stop themselves from getting colorectal cancer, that kind of thing. So if we improve these health devices, we're sort of making a huge impact on global health. So my advice to you guys is just make smart choices. Just think about when you're going to the pharmacy or when you're buying these sort of products, like if they're approved by the FDA, make sure that they're safe, and make sure you know how to use them before a crisis happens. Make sure, you read the manual as soon as you get it. That way, if something, awful happens, then you know how to use it in the moment. But make sure you have FDA approved things in your home. Just some acknowledgements before the end. I would like to thank Professor Feigenson at UCSB for her research, Dr. Taylor and her lab at the NIH for giving me some pointers on this presentation. Siddhartha Mukherjee, who's an author. I read his book, The Emperor of Maladies, which I really, really recommend for anyone who loves global health and science. It's about cancer, and it just got me really interested in the history of medicine in general. I was more of a science person before this, but now I realize the intersection of science and history is really important. So I highly recommend that book. And thank you to the GHLC for providing this very wonderful opportunity for me. I really enjoyed making this presentation and all the different presentations earlier in this summer. These are my references. And if you have any questions, this is my email, this is my Instagram. You can reach out to me there. Thank you very much.